According to the National AIDS Council, HIV prevalence rate amongst young women between 20 and 24 years is close to 3 times higher than in their male counterparts. The government of Zimbabwe recognizes the need to address social and structural factors that fuel young women's vulnerability to HIV infections. Addressing poverty will enable girls to avoid transactional and intergenerational sex, which are known to be key drivers of the epidemic. Through support from the Global Fund to end HIV, TB and malaria, the government of Zimbabwe will prioritize implementation of adolescent girls and young women-specific programs.
So the Global Fund has been funding Zimbabwe since 2002. And recently in 2017, when we got the allocation letter, the letter clearly stipulated that we are supposed to ensure that we focus on adolescent girls and young women and key affected populations. Most of the reason being that most of the new infections are taking place in adolescent girls and young women, and therefore, in terms of our previous funding requests, we did not focus on these subpopulations. So it is hoped that by 2020, that 8 million that was allocated from the Global Fund would have demonstrated results through targeted interventions focusing specifically on adolescent girls and young women, because we know these are the most vulnerable subpopulation of our society. So what we are doing now is ensuring that we want to capacitate organizations that deal with young women and girls, because in terms of programming, they say nothing for us without us. It's only young women and young girls who know what interventions work best for them.
I think that the Global Fund would definitely benefit adolescent girls and young women in a way that they can be able to access services and comprehensive information within different communities, because you find that especially in remote areas, there has been a lack of information of such.
In order for us to realize the demographic dividend, reduced new HIV infections amongst the adolescents and the young people, it is important for us young people to be active participants as we apply for more funding towards SRH programs in our local communities, in our local areas.
And what we're doing together with Youth Engage is to bring young women and adolescent girls to a platform where they can play an oversight role and begin to hold duty bearers accountable for the resources that we are receiving on their behalf. We know that it is easy sometimes for resources to be allocated, but sometimes we have challenges with disbursements, for example. And in other instances, yes, programs may be running, but other young women and adolescents out there may not be aware of what programs the government is putting in place to ensure that we stop the wave of new infections among that particular target group.
We want to start up an initiative where we have these young girls applying for every opportunity that comes up with Global Fund. And we'll be supporting them in these applications, ensuring that they do the right things the right way, and capacitating them in all essence. So number one, to make sure that the money gets to the right people, we need to put the right people in the right place. So that's what we're doing. We're making spaces for these young women.
Clearly, this program feeds into the Ministry of Health and Child Care drive to close the tap of new infections. If the government delivers on its promises and offers with efficiency services of support systems to reduce the wave of new infections, Zimbabwe will be closer to the global target to end AIDS by 2030.